They can embrace life again.
You say they become more active with.
Well,
which sounds like an exaggeration.
My experience has been that people wearing dentures and people missing teeth tend to withdraw. They tend not to want to be out in public. They tend not to want, they have to think about what they eat. They have to think about how they can clean their dentures. They have to think about the bad breath, all of those things. But there are other exciting things that happen. And this is a very good example of how you can change a life.
All right.
This woman was missing 2 teeth in the front of her mouth for her whole life. She was born without her lateral incisors.
Just born without 2 teeth on each side?
Right in the upper front of her mouth.
Okay.
And what you can see here is a certain type of smile. This was a vibrant, vibrant woman. This is what it looked like with 2 spaces in front of her mouth.
Did she tell you, by the way, she's embarrassed to smile?
Not only did she tell me she was embarrassed to smile, she'd been wearing a partial for years, which had affected her other teeth as well as the gums on the palate of her mouth. So we were able to put 2 implants in, and look at what we get as a result. But here's the most rewarding part. This is that same woman.
$1 million smile.
The $1 million smile. Couldn't be happier, is telling everybody about implants. She was terrified. She was absolutely terrified. She had no discomfort.
Why did she wait so long, by the way?
She didn't know it existed. She finally got herself into the hands of an excellent family dentist who I work with closely, and he referred her and said, you can have these. All we need to know is, do you have enough bone? Do you have enough quality, quantity, and volume of bone?
And how long does that take, by the way? Somebody goes into your office. How soon could they find out, that they're candidates?
In 1 visit. We're able to examine them. We're able to determine what their physical health is and whether or not they're a candidate in that regard. We can take a look at them clinically, and then generally we take regular films in the office, and then we send the patient out for a CAT scan. Now here's another one. She never liked her smile. When she smiled, this is what she looked like, and this is what she hated. She was told also that she had to lose a lot of teeth. And the one thing that caught her attention
because they were pretty white, these teeth. But they look from just the teeth pretty healthy, but they had to go?
Yes, she had periodontal disease.
Okay.
She had lost a lot of bone. Her teeth were crooked. They were moving around and shifting in her mouth. And she was really unhappy with the whole situation. But what was the selling point for her, in addition to just getting a new smile, was the fact that she'd never have to be without her teeth, that she would have fixed teeth in place through the whole process. And so what we did was we salvaged a few teeth to support a provisional or temporary bridge, and then we worked the implants in between the teeth, so that in a very, very short time we changed that to this.
Very nice.
And is this a different person?
Yeah, it really does look like a different person. So in the front area, you can make them, what are they made out of? Porcelain, as far as the tooth
These are crowns that are porcelain fused to gold. This woman's entire mouth has been restored with implants. You cannot, the greatest thing in dentistry is if you can create the dentistry being invisible, so that somebody looking at her says, gee, she just had her teeth capped. No. They look at her and say, what have you done?
It's a world-class smile.
Your smile is great.
I think when you put these side by side, there's a class difference. All you do is you fix her teeth, and you can see. I think anybody, when you put these side by side, could see the difference.
It's what's exciting. It's what brings me to work every day. It's the kind of thing that I never knew that I would be able to do when I graduated dental school.
Her options were what? A denture? Is that what somebody was?
That's what they were offering her. They take your teeth out and we'll give you a nice set of dentures.
How'd she hear about you, this attorney?
Well, I had treated a very good friend of hers from New York as well. And we're very fortunate in being in an urban environment. We have a tremendous diversity of patients, and they come from all over. So I've been very lucky to have a reputation in which people know that if they come to Philadelphia, they're going to get it done right. They're going to get it done once, and they're not going to have to do it over again.
Do you do the consults?
I do the consults myself. I want to know the patient before I know their teeth.
What are the denture wear, by the way? Something fixed in their mouth. We've talked a lot about 2 implants, snap in, snap out. So is that the #1 requested item? Give me something that doesn't come in and out. It's just fixed in your mouth?
Randy, patients would like to have what is the most natural possible thing. When they come to us, we offer them options. The truth of the matter is that depending upon the amount of bone that they have may determine whether or not they can have fixed. But almost always, if somebody wants a fixed denture or if they want fixed teeth, we can give it to them. It's only a matter of how many implants. As you saw before, 2 implants are enough to secure a denture, but think about an upper denture for a moment. We meet the public with our smile. We meet the public with our teeth. If we have a sunken-in look because we've lost bone, then we don't make the same impression on people when we first meet them. So if we can simply place 6 to 8 implants, 6 to 8 implants alone will give us everything that we need in order to stabilize permanently. This is a doctor removable only.
You say that they could taste their food better. How so?
Well, the biggest problem with wearing dentures, particularly on the upper denture, is that there's plastic or metal across the palate. Can you imagine the difference between drinking a cup of coffee and feeling that cup of coffee against your palate, or the textures of foods against your palate? If we can have a denture that's permanently fixed in place, that has no palate, meaning there's nothing up here, nothing that the patient is going to feel like there's something foreign, false. They don't get food caught under it.
Is that the biggest, I mean, when you do the upper, I mean, are they very pleased? Do they tell you, I can't believe what I was missing? What do they say?
They say, I can't believe what I was missing. I can chew foods that I couldn't chew before.
Could they eat a steak?
I've lost wrinkles. Okay. That's one of my most favorite. And yes, they can chew a steak, bite into an apple, eat an ear of corn. They tell me that they didn't understand the way it could be. I have not yet had one patient ever who has said to me after having implants that they wish they hadn't.
Final message, we're out of time. And great information here. Somebody missing teeth, what do they need?
There's no reason to go with a missing tooth in this day and age. As I tell my residents, anybody who's missing a tooth is a candidate for dental implants. It can literally change the way you live, change the way you eat, change the way you present yourself to the public.
And you could be 98 years old.
And you could be 98 years old. I'm looking for my first 100-year-old patient.
All right. Thanks again. Very interesting stuff.
Thank you for having me.
Thanks for coming on the show. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this program again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.